on the faculty of the McLean Center for Ethics there, which is where I got to meet Farr, who has been a wonderful colleague and a very good friend to me personally. Farr is a first-rate human being, and he reminds me, as a believing Christian physician, of the joyfulness that's supposed to come with our faith. I am always struck when I'm in the presence of Farr of kind of a very deep and real happiness that occupies his life. So it's a real pleasure to introduce him and to have him here today. And thank you, Farr.
Thank you, John. I don't have any slides either. I hope you will forgive me. I want to say, for those of you who are interested in the content of this talk and would like to, if there's one of you in here perhaps who wanted to think about it more, it hews pretty closely to comments I made to the President's Council on Bioethics on September 11 of last year. You can find those on the website if that interests you. And if you're interested in thinking hard about this issue of conscience, its place in medicine, and how we ought to think about conscientious refusals of certain clinical interventions, I would commend to you a special issue of Theoretical Medicine and Bioethics. Theoretical Medicine and Bioethics. It was published the fall of 2008 on this topic. And I had the privilege of editing the papers for that. And there's some really wonderful pieces there that show a range of different opinions. But I think if you were to read those papers, you really would come away with a strong sense of what the core issues are. And there's a paper in there by our own John Hart, interestingly, something on the title of Conscience Resources for Rapprochement from the Perceived Source of the Problem. And he talks about some of the Catholic tradition.
It's a catchy title, isn't it?
It's a catchy title. There's also a terrific essay by Dan Sulmazy, a Franciscan friar, physician, and new colleague of mine, whose work I would commend to you in its entirety. But there's a great essay there about what the conscience is and how we ought to think about it. Now, talking about conscience in this setting, I think, is appropriate for many reasons, one of which is that Catholic healthcare seems to be always in the thick of this. And at the front of this topic, it is really Catholic healthcare is one of the foremost contexts in which questions are raised about whether it is justifiable to refuse to provide legal medical interventions which patients seek, and if so, for what reason. It's also the case that as we think about healthcare reform, the U.S. Council of Catholic Bishops is, even yesterday, has been making known in a kind of public way their concern that current protections of clinicians' freedom to conscientiously refuse to participate in things that they find objectionable is not eroded, and in fact seem to be asking for a greater strengthening explicitly of those of former laws that protect clinicians' freedom to opt out of those sorts of practices. Now, I'm not going to get into all that policy. What I'm going to attempt to do is attempt to help us think rightly about the conscience, what it is, how it fits into the practice of medicine, and from that think together about how we should approach the phenomenon, which is very real, of patients requesting from their clinicians, or in some cases clinicians requesting of other clinicians the provision of some intervention which the clinician cannot provide or participate in good conscience. All right, that happens is a fact for many people in healthcare, and so the question is, well, what do we make of that? I'm going to argue that there is no obvious professional obligation to provide the sorts of medical interventions that have stirred of late this controversy about conscientious refusals in medicine. And I'm going to suggest that conscientious practice